First of all, thank you for the invitation, and excuse me for the small delay. You know that we have some political turbulences these days, and I had to be in some media. I rarely go to a media, but okay, this was one of the days. So I'm very honored being here and with this prestigious panel with people that I respect and I work with, to be honest, in order to find a way to deliver better health services to our patients. As we speak, we have under public consultation the new legislation for the system we want to introduce in order to have a system that will let us bring to Greece faster the new innovative drugs. Most of them has to do with cancer, to be honest. With the Society of the Oncologists, we have delivered a very sophisticated system of registry of our patients with cancer. And now, to be honest, Friday, we're going to test the new system for the protocols of the cancer drugs in Agios Savas Hospital in order to see how it works in order to be implemented in the next weeks. It's one of the targets we have in our RRF funding. This will help us be sure that we give the right medicine to the right patient. Because you know, all countries, and Greece of course, have to deal with a very difficult equation. And the problem is how we will manage to fit to a budget that has limits, needs that they are almost infinitive. In order to do that, we had a very strong cooperation with the doctors, with the medical community, and with the patient community, to be honest. I have to acknowledge Mr. Kapetanakis' help in this era to find a way to be very transparent in order how we're gonna introduce all these new therapies, because we live in a very interesting times. New therapies come very fast. This is fantastic news for the patient and for humanity, but also a very big challenge for the budget. I think these 2.5 years we have proved our political commitment to deliver things and to find a way to help the community of the patient as much as we can. We have started the national plan against cancer, which will be a bi-ministerial plan, much over than the Ministry of Health, in order to find the new framework that will help the government to not only give the right medicine or the right treatment, but fix the right environment for the patient and his family to adjust to the new life that cancer brings to a family. Because when cancer comes, life changing. And we try to find a way to take everything into account and see how the state can help the patients and their family to get through of all these difficult times. I'm proud. We have done a lot. We have to do a lot more. This is an effort that never ends. It is like the bicycle. You always have to exercise yourself. But I think we have managed to persuade the medical community and the society of the patients that we mean what we say, and we try to do our best.
Thank you very much for that. If I can just put a quick question to you. As you've said, this is a sort of never-ending cycle of constant innovation, but constant pressure to bring those innovations to patients within a limited budget. And the fiscal constraint, as is always the case in every area of policy, but in this area in particular, the fiscal constraint really determines how fast you can move and what you can do. We're in difficult fiscal times. So Is this changing your plans at all, given the circumstances that we're living through at the moment and the reversal, perhaps, of what we expected the fiscal position to be 3-4 months ago? Are your plans changing on the basis of that?
Until now, no.
Right.
But to be honest, you know, the Chinese have a very interesting proverb. They say, I wish you not to live in interesting times.
Yeah.
We in Greece, now in the recent 15 years, we live all in interesting times. Why they're bankrupt, then we had COVID, then we had the war in Ukraine, now we have the turbulence in the Middle East and the war in Iran. If you say to me, if I remember in the last 15 years, one whole year of calm and peace, no. So this is challenging, to be honest. It is challenging. I have to be very honest on that. But from the other hand, we proved ourselves resilient enough. Our economy performs well. I don't know if you know that but 10 days ago, IMF publicly declared that the Greek economy has one of the best performances in the Western world, which was not the case. If you asked me 10 years ago, when Mr. Thompson were here as a praetor of the Roman Empire, that IMF after 10 years will say that Greece has one of the best performances of our public finance in the world, I would say, you're a lunatic. But this is happening. So we're in a good shape. Of course, the companies, the pharmaceutical industry will always ask for more money. That's their job. From our hand, we will try to reduce the budget. That's our job, and we try to meet each other in the middle way. I have to be very honest, and I want to say that as a last comment. We have the extra challenge of the new policy, pharmaceutical policy in the United States of America. Because this new policy of the United States of America affects pharmaceutical industries around the world, and at the end will affect their presence in European Union and into Greece. This, for me, is bigger concern than Iran, to be honest.